If you're looking for relief from pelvic or abdominal pain, including pain from endometriosis, chronic prostatitis, painful bladder syndrome, or anything else causing you pelvic pain, this video is for you. I'm going to guide you through a progressive relaxation flow program to help you feel better. I'm Dr. Alex Hill. I'm a dual board certified physical therapist. Make sure that you subscribe to my channel for more videos on pelvic pain and pelvic health management. All right, first up is diaphragmatic breathing, which can be really helpful with decreasing the excitability and the sensitivity of the nervous system, as well as decreasing pain and getting the pelvic floor muscles moving better. Oftentimes with pelvic pain, these pelvic floor muscles are overactive and tight, and so we want to work on getting them more relaxed and not so tight. The diaphragm is the muscle that sits at the bottom of your ribs, and when you breathe, your diaphragm and your pelvic floor move together. So when you breathe in, the diaphragm and pelvic floor move down, and as you exhale, they naturally come back up. So we're going to be doing this diaphragmatic breathing, and I want you to feel your pelvic floor moving, your chest and your ribs all expanding out as you breathe in, and then recoiling gently back in as you breathe out. So sitting comfortably in a chair, or you can do this lying down, you're first going to put your hand on your chest and then one on your abdomen, and you're going to breathe in through the nose and feel your chest rise, your ribs expand, your pelvic floor drop down as everything gets filled up. And then you're going to exhale, feel the chest come back down, your ribs come back in, and the pelvic floor come back in. You're not actively pushing these muscles around, you're just letting them naturally move with that breathing. So let's go ahead and we'll do a couple of those breaths. So again, hand on your belly, hand on your chest. You're going to breathe in through the nose, feel everything expand, breathe out through the mouth, let everything come back in. I like to imagine ocean waves coming in and out gently at the beach. Go ahead, breathe in through the nose, feel the chest and pelvic floor expand, breathe out through the nose, nice and easy. Try to aim for about 4 seconds breathing in through the nose. Pause and then breathe out through the mouth. And we'll do that one more time. Breathe in through the nose, feel everything expand as you fill up your entire core with that air. And then breathe out through the mouth, feeling everything relax back in. All right, next up is called the body check, which is really helpful for you to be more mindful and be more aware of what your body is actually doing during the day, and especially when you have a pain flare-up. A lot of times with pain flare-ups, or if you have persistent pain, our body tends to be tight and overactive because it's trying to be protective, but that can keep you in the pain cycle. So we're working on checking in with our body from head to toe, toe to head, everywhere in between, to see where we're holding tension and to work on letting that go. The body check is great to do at least a couple times a day, and I do this at least a couple times a day, especially if I'm having a really stressful or busy day, just to help keep my nervous system calm and keep that pain down. You can do this either sitting or lying down. I'm going to be doing this sitting. So we're going to be starting all the way from the bottom of our body to our toes and working our way up to our head, checking in on our muscles and letting them go and relax as we move up the body. As we go to each body part, I want you to feel if you're holding tension. As I mentioned before, we're working from our toes up, but if you find that it's more helpful to go backwards and start from your head and work down, that totally works too, especially if you tend to find that you hold most of your tension in your jaw and your shoulders. All right, so getting in your comfortable position, you're going to take that slow diaphragmatic breath to help get grounded in your body. So breathe in through the nose, breathe out through the mouth. And then we're going to start at our toes. So you're going to bring your toes up. You can bring your ankles up too. And then you're going to point them down for a couple seconds. And then you're just going to let them go. You can kind of wiggle them around too. You'd be surprised how many people hold tension in their toes and their feet. The next place we're going to is our knees and our legs. So you're going to rotate your knees in, rotate them out, and then let them just rest into the chair sitting beneath you. Or if you're lying down, you're going to rotate your hips all the way in and all the way out, kind of like windshield wipers, and then let them relax and fall into the bed or again, into the chair beneath you. You really want to feel that everything is heavy and letting go. From the legs, then we're going to move up to the pelvic floor of the pelvis. If you get to this area and it starts to feel uncomfortable or it makes you feel a little uncomfortable going into this area, you can skip the pelvis area and come to that at the very end. Otherwise, if you're okay checking in with your pelvic floor, then you're going to sense, where is your pelvic floor? Are you holding it tense or is it relaxed? Go ahead and do a pelvic floor contraction. So you're going to squeeze the pelvic floor up and in, hold a couple seconds, and then let it drop completely. Then you're going to gently push out the pelvic floor, almost like you're gently passing gas, and then you're going to let it relax back up. But again, if you're sitting, it should feel like you're dropping the rectum and the pelvic floor down to the chair, feel like it's resting down, or if you're lying down, that it is just relaxing out. From the pelvic floor, then we're going up to the abdomen. So a lot of times we hold tension in our abdomen, we're constantly tightening it, maybe we're sucking it in throughout the day. If you're engaging your abdominals, your pelvic floor is also engaged. So we want to relax the abdomen. So go ahead and brace it for a couple seconds like someone's going to punch you. And then we're going to let it relax. You can go ahead, take another deep breath into the belly here. So breathe in, fill up that belly, and then exhale completely. Really feel like your abdomen relaxes here. From the abdomen, then we're going up to the chest. Sometimes for people, if they have persistent pain, they tend to do shallow breathing. They're not getting a lot of movement with their ribs and their chest. So we're going to take another one of those diaphragmatic breaths. So you're breathing in through the nose, fill up the chest and the ribs, feel that they expand, and then exhale, let them recoil back. Next, we're going to the shoulders. If you're sitting up, feel, are they up all the way to your ears? Are they really high up? If you're lying down, are they forward from the bed or the surface that you're lying on? If they are, go ahead and push them up a little bit more and then drop them down. So drop them away from your ears, drop them into the bed or the chair behind you. Feel that they get heavy. If you need to, you can even actively push them down away from your ears even more and then let them relax. And then next we come to the jaw. So especially if you have a tight jaw or TMJ issues, you tend to clench your jaw. Go ahead, just gently close your mouth even a little bit tighter. Open up your jaw as wide as you can. And then let it relax. So you want to feel that your jaw is not tense. And then finally, we're going to your eyes and your eyebrows. So are you squinching or tightening up your eyes? Are you furrowing your brow? Again, let those muscles go, relax the eyes, feel that your muscles in your face are relaxing. Excellent job. So that's a body check. Again, from toe to head, you can also go from head to toe. So relaxing the eyes and then the jaw, shoulders, chest, belly, pelvic floor, legs, and then toes. Do whatever feels good for you. But again, starting out, get more aware of what your body is doing and try to constantly just get it to relax and not be so tight and overprotective. All right, so we've worked on that diaphragmatic breathing. We've done the body check. Next is actively working on relaxing the pelvic floor muscles and getting more blood flow in this area. Just like with the other parts of this flow, you can do this sitting down or lying down. And what you're going to do is gently contract the pelvic floor muscles, so gently squeeze them. And then you're going to relax them and then gently push down, almost like you're trying to gently pass gas. None of these movements should be very abrupt or strong or fast. These are nice, easy movements. For the pelvic floor muscles, you can kind of think of them like an elevator. So you're starting at the ground floor. When you contract, you're coming a couple floors up as you contract, dropping back down to the ground floor when you relax, and then gently pushing to move the elevator down to the basement, and then come back up. Ideally, we do this with our breath, so that's what I'll instruct you on, but if it's hard to do it with the breath and coordinate it, just focus on the movement of the pelvic floor muscles and not holding your breath. All right, so first you're going to breathe in through the nose. As you breathe out, you're going to contract the pelvic floor muscles gently. You should feel them draw in and up. And then you're going to breathe in to relax the pelvic floor muscles back to resting. And then breathe out as you gently push the pelvic floor muscles out. Again, like you're gently passing gas, you're just pushing down to that basement. And then breathe in to come back to resting. So again, you're going to breathe in, let them relax. Breathe out, gently contract. Do that for a couple seconds. Breathe in, let them go. Breathe out, gently push down. Breathe in, let them come back up. So everything should be about 3 to 4 seconds, okay? So we're gonna breathe in, breathe out, gently contract. Breathe in, let them go. Breathe out, gently push down. Breathe in, let them come back up to resting. Breathe out and contract. Breathe in, let them go. Breathe out, gently push down. Breathe in, let them come back up. We'll do that one more time. Again, feel your ribs, your chest, your pelvic floor, your belly, all should be moving with this. Breathe in first. Breathe out as you gently contract. Breathe in, let them go. And then breathe out as you gently push them out. And then breathe in, let them come back up to resting. You can do that exercise a couple times a day or anytime that you start to feel some of that pelvic tension or pelvic pain, just to kind of reset those pelvic floor muscles, get some more mobility and get some more blood flow. Come back to this video anytime you need guidance on calming down your nervous system and calming down that pelvic pain. Please like this video if you found it helpful and make sure to subscribe to my channel below for more videos on pelvic health and pelvic pain.